Hey guys, this is Dr. Sean over at Fortis, and this is week number 5 for terminology, and we're going to go over all of this stuff right here, which is the signals, hormones, and sensing the world around us. So it's going to talk about the endocrine system, the endocrine glands. Endo means inside, right? Crine, C-R-I-N-E, generally means timing, so it has to do with the glands and the way that things are timed. It's a slower moving system than, say, the nervous system. The nervous system is your fast acting response and sending unit, which receives information for the cerebrum, the central nervous system, the peripheral nervous system, and the autonomic nervous system. And then you have what are called efferent, exiting the brain away from, that's sending motor nerves to be able to do things like this. And afferent, which is back towards, so when you touch something, you go, oh, that's cold, that's hot. You'll know those kind of things. So we'll also talk about a little bit about the problems with different hormones. So like you have like growth hormone, which makes you grow, or the lack of growth hormone, which can keep you into a thing called dwarfism. And so we want to kind of understand some of those things. Other things like thyroid issues, Graves' disease, Hashimoto's thyroiditis, et cetera, et cetera. We have Addison's disease, which is an adrenal problem. Now, one of the things you're going to notice in terminology is you're going to start seeing a lot of the names of people, Addison, for example, or Hashimoto's. Those are going to start disappearing because we're trying to get to a more combined language where everyone can understand, other than having to understand the guy or the woman who discovered or coined the term. So let's go through a speed run real quick of a couple minutes for this. And here we are, learning outcomes, talks about applied terminology related to nervous system, talks about the function of the nervous system, the functions of the eye. The eye is, it bends light and it receives light and images, and those are reflected through the lens, through the cornea, which is in the front, and through the aqueous humor, which aqueous means water-like, humor means like fluid, and then it goes through the vitreous, which vitriol means thick kind of fluid, and that goes back to the retina, and the retina stimulates the rods and the cones, and that sends the information back through the optic nerve, through the optic chiasm, which is right in the middle of the head, back to the occipital, which you remember that one, lobe for discernment, and then it sends information to everybody else to determine what you want to do. Do you want to grab it and put it in your mouth? Do you want to get away from it? Do you want to smack it? Whatever it is, if it's a spider or something like that. Apply terminology to otology, which is ears, okay? Auto, like an otoscope. Okay, otoscope is to listen to the hearing. Let's open this up just a skosh more because there we go. We'll just do like this. Yeah, so I can sit this way and communicate with medical terminology related to nervous and endocrine system, the eye and ear, and verbal forms. So it doesn't do a whole lot with other senses like smell. Olfactory, okay? Otolaryngologist is the ear, nose, throat doctor. Otolaryngologist. So someone who studies all of those things. That's a big word to understand. Nervous system, eye and ear, and endocrine system. So very, very good. We're going to go through this. I'd like to do it in about 3 more minutes. This is just our speed run. Remember, I want to go through some of the ideas we got here. What are we looking at? Table of contents, the textbook. Some people were having problems with the textbook. That seems to have been worked out, I hope. You shouldn't be having problems with the textbook. But here we go. There's the nervous system. Highway of signals, it's called, right? So we're going to talk about the MRIs and CT scans where you can see things like brain tissue. Brain tissue is about 50% fat tissue, and it's about 80% water, just like everything else in the body. So imagine it's just a bunch of little gristle that decides what you are and what you're doing and what you're thinking, right? So we have up through here, you can go through this entire thing. Some words, I'll just explain what they are so that we can pronounce them correctly. Brain, cerebrum, right? Spinal cord, well, that's spinal cord. Cerebellum, right? Brachial means arm. Plexus is a group of nerves that goes down. Musculocutaneous, musculo goes to the muscles, and cutaneous, skin nerve. Radial, on the radial side, the thumb side is the radius, that's rad, right? And the ulna is the opposite side. The median nerve's in the middle. And as we go down through here, let's see, ilio, hypogastric. So it tells you where it's going. It's going to the ilium, the top of the pelvis, and then the hypo underneath the stomach. So that's where it goes, right in the back. The genitofemoral nerve goes from the genitals, right, and femur, which is the thigh. So it's kind of the inside of the thigh. That's where that one would go. The nerve of the obturator. That's a nerve that goes underneath in your sitting bones. There's a place called the obturator. Ulnar nerve, that's on the ulnar side. That's the pinky side over here. The ulna is this bone. Remember, radius. Ulna. Radius because it turns, it rotates around. Common peroneal nerve that goes down the leg, right? That one, see, we're not liking that one too great because it looks like it shows the same one as the sciatic nerve on the opposite side, which is not the same nerve. Deep peroneal nerve goes down the side of the inside of the calf, and then the superficial on the surface, peroneal nerve. On the other side, we have intercostal, between costal ribs, okay? Intercostal nerves. Subcostal, underneath the ribs. Lumbar plexus, again, an area. We have the cervical plexus, the brachial plexus, and the lumbar plexus. And then we have the sacral plexus is down at the bottom. That's actually a little bit further down when that one goes down into the sacrum itself. Remember, the sacrum is the bottom bone, right? Remember, spinal cord, spinal column, 7 bones in the neck. It's always 7. You have breakfast at 7. 12 in the thoracic, the mid-back. You have lunch at 12. And then at 5, you should have supper or something like that. And that would be the lumbar at 5. Pudendal. Pudendal goes to the bottom where the sun don't shine, really is where it goes. Sciatic, people talk about sciatica, right? And that's an inflammation of the sciatic nerve from it being pinched on because of misalignment in the spine or other areas of the low back, right? You can have pinching from muscles and stuff called piriformis syndrome, actually. Then there's muscular branches of the femoral nerve. So a lot of nerves go to the muscles of the femur, and that's going to be the muscles of the the muscles of the femur are going to be the quadriceps, which is 4 muscles, and then you have the hamstrings, which is the back muscles, the leg flexors, hamstrings, because you would hang a ham by those same tendons. So we got the same one. Then tibial nerve. So there's an anterior and a posterior tibial nerve. I'm drinking my tea. So the brain is kind of the epicenter. That's where all the control happens. Here's your little healing from trauma and little video, the polyvagal, which is a really good, I think, video on this whole thing, which I'm going to watch in a little bit again because I like it. You'll hear more about polyvagal technique and polyvagal theory. It's just very hip right now. It has to do with the vagus nerve, which is the 10th cranial nerve, nerves that come off the cranium, right? The endocrine system here, we're talking about all of these. Oh, they're not going to show us the whole list yet, but we have the hypothalamus. Hypothalamus is the control center of all of that, all of the endocrine system, right? It's part of the brain, the lowest part of the brain, right before the pituitary gland, which is right up and through here and straight in through here and down like this. So you find that little pituitary gland in there, and it has all of the cool hormones that are in there. So let's I'm going to pronounce these ones, and then we're going to be done, right? Trophin, thyroid, trophin development, releasing hormone. Next one down is dopamine. That's your reward chemical. That's what you're getting when you scroll through and get some good information, or like that ding. I get a little dopamine boost because maybe it's someone I want to hear from, right? Growth hormone, releasing hormones. See, GHRH, right? It's that one. Somatostatin. Statin has to do with making still, basically. It's a blood pressure one too. Gonadotropin. Gonads are going to be for males is testes, and for females it's ovaries. Gonadotropin development releasing hormone. So it's going to tell us some other thing what to do. Corticotropin releasing hormone, that's going to go down to the adrenals, which are on top of the kidneys. Oxytocin, that's the I love you chemical, and we release that one down there. And if you have enough of it or a lot of it, people start looking very familiar. If you don't have enough, people start looking really strange. It kind of leads to other things too. Vasopressin, vessels, pressin, pressure, has to do with the pressure. Down to the thyroid, right here in the neck. And if you can swallow, you put your fingers there and you swallow and you don't feel anything, you shouldn't feel anything because there's nothing there. If you have a problem, it could be what's called a goiter, right? Triiodothyronine, okay? So this is a different chemical, T3, and then thyroxine, okay? You're going to release those. Those are metabolites. They help you metabolism. Pineal gland, back here, straight in here, okay? Pineal gland, some people say it's like the master gland of everything. Actually, a guy named Descartes back in the 1600s thought it was where your consciousness was. So he would say, I think, therefore I am, and it comes from there. But it doesn't. It's a totally different thing. Melatonin is released because you have You want to be tired when it's time to be tired, and awake when it's time to be awake. Back to the pituitary gland is underneath the hypothalamus, so we have growth hormone. Remember, over on the other side we had growth hormone, releasing hormone. Oxytocin, thyroid stimulating hormone, stimulates the thyroid to release its stuff. Vasopressin, again, right? Adrenocorticotropic hormone. Adrenals, cortex development hormone. Oxytocin is also stored in the pituitary gland. Follicle stimulating FSH, you've heard that one before if you've done any anatomy and physiology before, because we talk about it like crazy with the menstrual system, but both males and females both release those from the same place, just in different amounts. Luteinizing hormone, another one. Luteinizing means to make light, right? Prolactin, lactose and lactase and lactose and stuff like that has to do with breast development and the release of milk when the baby's born. Intermediate pituitary is a melanocyte stimulating hormone, so that one can help you grow your melanocytes, which darkens your skin. Okay. Oxytocin, antidiuretic hormone is in that area, and that one keeps you from peeing too much, right? If you're getting dehydrated, it's going to release that. So anyway, there we go. I didn't want to go too deep into that. That's 11 minutes. Oh my gosh, I got to stop. Anyway, hope you guys are doing good. This was the speed run for week 5. Don't forget to, when you do the discussions, do two. I'm putting hints in all of the discussions to you, so watch those, please. And we'll talk to you soon. Take care. Bye.